We're so cute.
And hot and sexy.
And hot and sexy and cool and smart.
And beautiful.
And we're really intelligent.
And we're really smart, yeah.
And we're wearing capris today.
And we're wearing capris.
Welcome to Pelvic POV with your hosts and doctors of physical therapy, Amanda Neary and Hannah Meyer. Hey, pelvic freaks. Welcome back to another episode of Pelvic POV.
Where you're freaks for us and we're freaks for your pelvis, baby.
I felt really strong in that intro.
You're getting good. I mean, you've always been good.
Lately, I've been having to double take them.
No, you're fine.
You know, I had a confidence issue.
It's okay.
And now it's fine.
Yeah.
We worked it out.
We're wearing capris today. That's probably why it worked out.
Yeah. Guys, can you see? I just showed my bare leg there. Do you see these jeans?
Me and Amanda are both wearing capris.
Yeah.
Is this 2008?
Well, specifically, you're wearing like gauchos.
Yeah, I am.
Do you remember gauchos?
Yeah, I do.
Because you're wearing them.
I remember specifically the brown ones with the brown Bobby. What's that fucking monkey's name? Billy Mac.
Oh my gosh, yeah.
Bobby Joe. Bobby Mac.
Billy Joel.
I forget what it's called.
Funky Monkey. I know Bobby Brown.
Someone knows.
I'm listing brands. Can we bring gauchos back for real? Because why are we bringing back things that aren't comfortable? Because why are we bringing back skinny jeans when I don't want to wear those ever again?
No.
I want like flowy gaucho pants.
Yeah, give it to me.
Yeah. And we're pelvic floor therapists. Talk about breathable organic cotton clothing for your vagina.
I'm sure once skinny jeans were abolished that people started having way less pelvic floor dysfunction.
Totally.
There should have been research.
Not abolished. Abolished skinny jeans.
Oh God. Yeah.
Oh,
but God. the people are bringing that back. I don't know. I don't think about it. I don't think I'm going to do it.
I'm not doing skinny jeans again. It's not good on my body type.
Fast forward to like 6 months from now. We're both wearing skinny jeans.
The only time I would wear a skinny jean is with a tall boot that I wanted tucked into my jean.
I wear like the boot cut jeans. I like those.
You do wear those.
I like
wear
that.
A straight jean. I think I'm a wide leg or a cropped jean till I die. Just on my body type, it looks best. Unless I'm wearing like a knee-high boot and I want my jeans inside the boot.
Yeah.
Then I would have to wear a skinny jean.
Yeah.
If
you're a pelvic freak, you like gauchos and wide leg pants.
Facts.
Then that's that.
And that's the episode.
P.S. If you saw me in Westlake yesterday, no, you didn't.
Hannah has a gnarly eye situation going on.
I have an eye abrasion, so that's why I'm wearing my glasses.
I don't like feel like you look that different, but when I was setting up the camera, I was like, yeah.
I know. You gave me a look. I know. You look double taked me.
Is that really what you look like today?
Yeah, it's fine.
I'm not used to seeing you like not made up for the pod.
I know. You know what, guys? Deal with it.
You still look hot.
Yeah, of course I do.
Yeah. I mean, as long as you know that.
Yeah, great. So the whole story is yesterday I made an emergency eye doctor appointment because I couldn't open my left eye. And I saw 3 patients prior to this. So sorry to those patients that I was treating with like one eye like twitching the entire time. The eye doctor is right down the street from us. So I just like popped over. Like I didn't even bring anything. I just like walked over, no jacket, nothing. I was like, it's gonna be really quick. Okay, well then it starts pouring rain out of nowhere, thunder, like within 2 minutes. And it's an 8-minute walk. And I am soaking wet. I show up to the eye doctor. My hair, it looks like I just got out of the shower. I'm covered in rain. Like my whole sweatshirt soaked. I was wearing a gray sweatshirt. And they like walk in and they're like, oh my God, are you okay? Like it was embarrassing. I like sat in the eye doctor chair. The whole seat was wet. It was so stupid.
Yeah.
And then, yeah, she gave me some freaking medication. But I was like, I need to go home and go to sleep now. But anyways, I was sprinting down Madison Street, like covering my eye in the rain like this.
The rain was awful. I had a dentist appointment that I voluntarily booked months ago. And I was at my apartment yesterday morning. My roommate was working from the couch and she's like, oh, it's a rainy day. I'm going to work from the couch. And I was like, the last thing I want to do is walk to the dentist in the rain. But it's not far enough to justify an Uber. And I also didn't want to go to the parking garage and like unpark my car, try to park it on Madison Street. Like that wasn't worth it either. That was going to take like 3 times as long as walking.
Do you late cancel?
It's literally a 5 minute walk. No, I went, but I
Nice.
was soaked, freaking soaked. It was in like the peak of the downpour. And I was prepared. I had rain boots, raincoat, and umbrella, and I was still soaked.
Here's my thing. I think that thunderstorm put us in an alternate dimension. I'm not kidding.
Explain.
I think a lot of things happened during that thunderstorm. It sucked us in and it spit us out. And now our podcast is going to have like 10K followers.
Yeah. Wait, hold on. I didn't process the last part. Hell yeah. Ooh, wow.
Guys, we've been ranting to you a lot lately.
We have
Thank
been.
you. Thank you for letting us do that.
Thank you for letting us rant and feeling like I've gotten feedback lately that it's people think they're just like having a conversation with their friend when they hear us. And I really like that. Like one of my friends listens to us on her way to work and she always tells me like, I don't know if you and Hannah had a conversation or you and I had a conversation because I like remember and it feels like I'm just talking to you about stuff.
Ooh.
I'm like, that's so cute.
That is glorious feedback.
Glorious.
I love that. Oh, speaking of words.
Oh, we need a word of the week to use in a
Guys, we're going to
sentence.
try to start incorporating new things and see if you like it.
Whoa, word of the week.
What's the word of the week?
Who's picking it today?
You?
Okay, I'm going to pick a word and Hannah has to use it in a sentence at some point in this episode.
You're going to have to give me the definition.
This was inspired because Hannah really likes words.
Yeah.
She likes learning new words.
I do be liking words.
Yeah, so Hannah's really into vocab these days. I have one.
Okay, yes.
Okay, the word I want you to use in a sentence today is abysmal.
Oh, that's a good one.
The definition of abysmal is extremely bad or appalling. The quality of her work is abysmal. Is the example.
That's funny.
I like this word.
That's
I
hilarious.
haven't used it in a minute, so I was like, that seems fun.
Extremely bad or appalling.
So Hannah's going to use abysmal at some point in this podcast episode.
Yeah.
Should we talk about how we went on a double date finally?
Oh my God, yeah.
We went on a double date, guys, and it was super cute. It was actually really fun. That was like that was probably my favorite double date I've ever been on.
No, yeah, we went to Guilt Bar. Do you guys know what that is? It's
We went to Guilt Bar.
I've never been there, but it's one of the hog salt restaurants. And so like Trevally Tavern, Guilt Bar, Bavette's in Chicago. If you know, you know. But it was really good.
So good. And they have a really cute photo booth situation downstairs. So they have a speakeasy, which by the way, did you guys walk into it?
No.
So cute. The library
we
bar.
need to go.
We walked into it and we were like, next time we would come here after, but it's like the same vibe as upstairs, but just small.
Like cocktail-y.
So because we wanted to go to Lone Wolf, which didn't happen, we were like, let's do this next time. But the photo booth downstairs, their whole thing is like they have all the photo booth stickers like pinned to the wall. So you take photos and you pin it to the wall. I selfishly kept all of mine. It was really cute. It was a fun date.
Oh, I think I pinned one guy up there.
So the person I took on the date, she was like, you and Hannah are so cute together and I love your vibe and you're just such a good duo. And I love that. This is such cute feedback.
We are cute. We know this.
We're so cute.
And hot and sexy.
And hot and sexy and cool and smart.
And beautiful.
And we're really intelligent.
And we're really smart, yeah.
And we're
super
wearing
smart.
capris today.
And we're wearing capris. And I'm wearing a Skims top.
Big time. Yeah.
Slutting out.
Slut out summer. God, I can't wait for concerts.
Oh my God. I can't wait to slut out so hard at a concert.
We got to do another Salt Shed concert this summer. That was fun.
I'm
That was
trying
like
to think
one
who's
of the
coming to
first
Salt
times
Shed.
we hung out.
Everyone I want to see in concert is touring in Europe.
I mean, a lot of our people toured here last year. So now they're going to Europe and they're not here.
I'm totally fine going to Europe. I want to go to Italy.
I'm going to Europe for a concert in a month
Yeah, I know.
to see Chapel Roan.
That's going to be good. I
So excited.
want to go to Italy though.
Yeah.
I want to go to Sicily.
Let's do a girls' trip to Italy.
Okay.
Sabrina Carpenter style.
That post was my, I almost said Roman's Revenge. What is it?
Roman Empire.
Oh yeah, that post was my Roman Empire. She looked so good on that trip. Did she go to Sicily? I think she
it
did.
was Sicily. I don't know where they went in Italy.
I don't know, but I want to go with
Yeah.
you because you're Italian.
Yeah, that'd be fun.
Yeah,
I love Italy.
yeah. And you've been doing your Duolingo.
I'm on my 100-day streak.
Good job.
I learned Italian as a kid, so a lot of it's coming back, but I'm at the point now where I'm learning new things, which is fun.
Cool.
Yeah. What do we want to chat about today?
We're going to talk about maybe the number one thing you might be missing in your pelvic floor care that could literally change your life.
Wow.
Yeah,
That was a really intro.
I know. Guess what it is, Amanda?
I'm supposed to guess, but I already know.
Okay, it's dry needling.
It's dry needling, if
Yeah.
you've heard of it.
Yeah.
You may have heard of acupuncture before. If you haven't heard of dry needling, it is a similar practice, but very different at the same time. So they use the same needles, same needle width, but it is a different technique. So dry needling will focus on a trigger point release within the muscle. So it's usually a longer needle that gets deeper depending on the muscle group. So we're not focusing on like that surface level where you just tap it in and you're working on that like meridian along the body. This is a Western needling technique. So derived from traditional Chinese medicine of acupuncture, taken to adapt it to trigger point muscle release. So we're doing something completely different.
Go back and listen to our episode on acupuncture with Ashley Flores. She gives pretty good detail on what the difference is between acupuncture and dry needling. As pelvic floor PTs, trigger point dry needling is what we do, and it is astronomically amazing
Yeah,
for treatment of pelvic pain.
I agree. And it's one of the few manual therapies that actually has some pretty solid research behind it on what it can do to a muscle trigger point. So a trigger point might be an area where you have excess muscle tension, where muscle almost feels like partially contracted on the cellular level. So there could be a buildup of chemicals in that area, such as like acetylcholine, that create more acidity that make it more difficult to relax that muscle. So with the needle, there's actually research on with pistoning technique, which is coming in and out of that trigger point, it can manually release that trigger point. So we're not saying this is the end all be all and that you can't release trigger points without a needle, but it is one of the more effective methods to actually do that. And we're basically looking for either a pain response or a twitch response in the muscle when we do this. So if we're getting that twitch response, we know we're activating that trigger point and that muscle is firing, which is also going to help it relax. And also, we can look for a reproduction of the patient's pain that they're experiencing. So this is another big difference between dry needling and acupuncture, is that we are eliciting a painful response from patients when we do this.
How we find a trigger point, how we were taught in myopain seminars, which if you're a PT listening to this, we highly recommend that course. That's the course that we did, and it was amazing. It's a 3-day course, but they describe it as a top band. So we're palpating the muscle and you'll feel literally a band of tissue. And then along that top band, you'll find a hypersensitive spot. Amanda, I describe this to people in a weird way and I want to see if you like it.
Okay.
Okay. So, when you have a necklace and you get it tangled up and there's a little knot and it pulls on the necklace and you're trying to release the knot, I describe it as I'm taking a needle and putting it into that knot in the necklace and it unravels the knot so then I can just straighten out my necklace and now I can wear it.
Yeah.
That's how I describe it to people.
That's pretty good, actually.
So I don't know if that helps you to visualize kind of what we're doing to the muscle, because then we're allowing the muscle to release tension so it can relax and contract appropriately. So sometimes after we do dry needling with patients, they'll have, yes, you'll be sore from dry needling, but you could have better muscle activation. So let's say we're needling your glute med and we test your hip abduction strength before we needle and it's weak. Sometimes immediately after we needle, you'll have a stronger reaction when we test your hip abduction strength. You'll be able to withstand more.
They actually studied this on racehorses. So there's a lot of dry needling for professional animals, actually.
That's so cool.
Which is interesting because they would needle the racehorse and then they would be faster. So that's how they came to know that needling can impact muscle performance. So we do this for multiple reasons. We can do it to retrain muscles, better contract, help them better contract, we can also do this to reduce pain and symptoms that are associated with that trigger point. What I really love about needling for the pelvic floor is we're getting so deep with our internal assessments, like obturator internus, these muscles that are a little bit deeper that you can't really get from that external trigger point, because yes, for certain muscle groups, you can apply pressure superficially and it will also release a trigger point. But with a needle, you can just get so much deeper and you can get muscles that you wouldn't normally get. So I'm immediately thinking about hip rotators when I think of that, because you're getting closest to the joint itself. On a ball and socket joint, which has 6 planes of motion, those muscles are going to be deepest. They're going to be the hardest to get to. We're not going to be able to palpate them. I'm thinking of those, and I'm thinking of the psoas, which we can't actually palpate. If anyone ever tells you they feel your psoas with their hands, they are lying to you. You cannot feel that
thing
muscle.
is deep.
That thing is deep. You cannot feel it. For example, I'm using a 60 millimeter needle, which is like, I don't know, that long, to finally get to your psoas. I can't feel that with my hands.
75 millimeters sometimes.
Yeah.
Heck, maybe 100.
It depends on the patient and their anatomy. But yeah, at least a 60, I would say, for psoas.
I want to give some examples. One time I needled a patient, had never been dry needled before, and was a runner, but we needled her glutes, both glutes, bilateral glutes, in one session. She said the next day when she went on her run, it was her fastest pace she had run in like years, like before her pregnancy. I think she had hit like a 7-minute pace. And she came back the next session, was like, I haven't run that fast in, I don't remember the last time when. And ever since then, she was totally hooked on dry needling. And It's been super helpful for her care.
Sick.
So that's an example of, dry needling that we've done for better muscle activation. But yes, we're trigger point dry needling in a specific spot. It will feel tender, but there's also crazy vast referral patterns from the muscles that we needle. So for example, we just had our bladder episode that we did. If you haven't listened to it, go listen to it. But a common place that we'll needle for people that have pain in the bladder, like I see, is the pyramidalis, because it refers directly to the bladder.
Love the pyramidalis.
Yeah. That one's so a good one. Oh, if you guys don't know what the pyramidalis is, if you touch right above your pubic bone and kind of like push into your pubic bone.
Do you know what a pubic, but do they know what a pubic bone is?
It's like the anterior or the front of your pelvis. So like where your two halves of your pelvis connect in front of you, it's going to be that hard bony part. And then if you palpate right above that, it's going to be a little bit muscly. That's your pyramidalis. It's a tiny, tiny muscle that if you are PT, you probably forgot about.
Yeah. If you think about your pretty abs, the ones that like you build a six pack in, it's the lowest portion. It connects onto that rectus abdominis muscle and it attaches onto the pubic bone. So we're needling right on that attachment.
I will say, like, needling for this one, for me, was abysmal.
There it is.
It was so painful, but for other people it's fine. But needling the abdomen for me is a touchy area.
Yeah, for me, abdomen, hip flexors, adductors, I will
kick you in the face.
I'll fight you. I will throw hands. I will. In the course, they were like, "Let me needle your obliques. I got to practice." And I was like, "Okay, I really, really hate you right now." But I mean, if it's effective and you can tolerate it, wow, the difference it can make, especially for bladder symptoms. Oh my God.
Yeah.
Amazing.
It's nice.
It refers to the bladder. It's like one of those muscles where it might not even be a bladder issue. It might be your abdominal wall.
Yeah. Some other muscles that we will treat that refer places. Piriformis is a big one that I do for tailbone pain because it refers to that like outer sacral area. And that one has made huge differences for people, even for pelvic pain internally.
This is actually just a great point in general. Referral patterns are really weird, guys. If you're thinking of like, why would I feel that in my bladder? That's not even the start of it. The pelvic floor itself has a ton of referral points that can venture all the way to the shoulder and the ankle that we have not studied well and have only been studied in recent years. So realistically, we can palpate internally in your pelvic floor and you can feel that pretty much anywhere from like the knees to the rib cage. That's kind of our range. So we might be on a muscle where you're like, that's not where I have my pain. You might still feel that where you have pain based on that muscle's referral pattern. And that's a lot of what we learn in dry needling is, okay, they're feeling this here, but I'm not finding a trigger point on that muscle. What other areas can I look at that might be driving that pain? And that's where needling is really, really cool.
Yeah. So sometimes patients will be confused. Like I'll have a patient that comes in, maybe they only have pain with intercourse. That's it. No hip pain, nothing else. Vaginally, that's where their pain is, right? Then they're like, why are we needling my glutes? Why are we needling my abdomen? Why are we needling my adductors, my inner thighs, butt muscles, and my tummy? We've talked about this before. These are all accessory muscles to the pelvic floor. Since there's such close proximity to those internal muscles, which, there is a course on needling the internal muscles, but I don't want a needle in there. Stay away. Get out of there.
This is another good thing to address because not everyone can tolerate dry needling. So what is the therapeutic benefit for someone that is either in excruciating pain or has crippling anxiety around the use of a needle? And this is beyond people who have a visceral response. So there's some people who cannot tolerate needling in the sense that they will pass out, faint, throw up, and we just can't do it. It's contraindicated for those patients. But there are patients that know the benefits of it, are willing to try it, but are terrified. And it's almost getting to that point where what is going to be the benefit here if you're that stressed and worried about it? So in the course we took, at least in my opinion, they teach the most effective method, which is pistoning, moving the needle in and out. And if someone falls into this category, I'm not going to do that pistoning technique right away. I'm going to maybe piston a couple times to find the trigger point, but then I'm just going to leave the needle there and let the patient build a tolerance to the needle in that position. And I'll supervise it. I can put a few in at a time and kind of watch them, and maybe we'll start to piston if they get more comfortable. I'm kind of getting off the topic of the internal needling now, but my mind when I think of needling someone internally is I would never tolerate that. Even if you just stuck it in and didn't piston. I don't want a needle in my vagina.
Nope. No.
So I'm not going to do that to a patient.
Get out of there.
If I'm not willing to even try it in a course, I'm not doing it to a patient.
No.
Yeah.
No. Hell no.
There's some things that should have stayed thoughts.
And that's one of them.
That's one of them. I'm not. And listen, I would love to get someone on here who has another argument for this because I just think we're like-minded in this way where it's I don't see the benefit in that. Maybe there is one and we're just not the people to do it, but I don't feel comfortable doing that.
They do pelvic pain injections, which is trigger point injections instead of trigger point dry needling. And they don't even insert the needle internally, but it's still massively uncomfortable for people.
And that's different. They use numbing on that, and they're inserting it where we would typically insert our needles, external tissue, and then they get to that point and they inject. So they're still needling the muscles that we needle.
Yeah.
To insert a needle through the vaginal canal. I don't know.
Yeah, I don't know.
I'm not seeing that one for me in my practice.
And you know what? We don't really need to because we see such good results by doing dry needling the way we do it. So me and Amanda approach the same way. We usually will start with the big O's, which we say usually the glutes are a pretty big one because they're a bigger muscle group. And then we kind of if that's not working, we'll narrow down to maybe some smaller muscles. Like the obturator internus is one of those muscles that is an internal muscle, but it has external fibers on the medial portion of your sit bone. So if you are sitting on your butt right now, if you feel right underneath your butt where the bony part that hits your chair, that's your sit bone. We needle inner, if you feel a little bit more inwards to that, closer to your vagina or your butthole, that's gonna be where your obturator sits, where we can needle, and that's a really good muscle for a lot of chronic pelvic pain people.
Yeah, obturator, we can hit it from the distal portion of those fibers too, which is close to your hip bone, that bony part if you're feeling the side of your leg, and then we can go in through the butt crack close to the butthole to actually get not me saying butthole,
your butt crack close to your butthole.
Butt crack close to butthole, so we can actually get those fibers, but it's still external. We're not going through the pelvic floor, but that's about as deep as we get, and we see amazing results with this.
Yeah, let's talk about the adductors because you mentioned it.
Woof.
Adductors are your inner thigh muscles. I want you right now to palpate or which means just to touch your inner thighs.
I'm doing it to pull my jeans out of my crotch.
I'm doing it. Ugh. Yeah, it's okay. If you palpate your inner thighs and maybe like press a little hard if it's super tender, oof, that could be a good muscle to needle. If you have pain with insertion, which with penetrative intercourse, if you're like, oh, it hurts when my partner or whoever I'm having sex with inserts their penis or finger or anything into my vagina, the adductors are a good one for that, to relax that first layer of the pelvic floor.
They are a really good one, even though I will kick your face.
Even though I'll punch you in the throat.
Even though I'll punch you in the throat. Listen, we didn't say it wasn't painful. Actually, this is a qualm of mine. I'm bringing back qualm.
What's the qualm?
Some people say that dry needling isn't painful, and they're liars and fakers. Dry needling is supposed to be painful.
I know.
It will be painful.
If you're my patient, I will not gaslight you.
I'm not going to gaslight you.
It's going to be a little uncomfortable, maybe painful, Everyone's pain tolerance is different. Usually it takes a couple sessions to get used to the feeling and you get better at tolerating it because you're used to how that pain feels. It's a very different kind of pain, I would say.
And it's different based on what muscle you're needling. That like dull, achy muscle pain, I think is more tolerable than like the adductor feels sharper to me. Mm-hmm. And that's a more like almost superficial feeling pain.
Yeah. Different parts of your body are going to be more sensitive. Just think about like when you're getting a tattoo. If you get a tattoo on the top of your foot, it's going to hurt way more than if you get a tattoo on your like left shoulder. Mm-hmm. So
not the left shoulder.
Thinking specifically from personal experience.
I was like, do you have one on the top of your foot?
I have one on the side of my foot and it's a Mercedes-Benz logo.
Yeah, that one I know, but my side of my ankle
Luxury
tattoo,
feet.
my ankle tattoo wasn't painful, but I hear top of the feet is worse. Mm-hmm. Did we kind of cover dry needling?
Okay, let's see. We hit adductors. Hamstrings are another big one that we needle. Hip flexors, like you said. We can hit iliacus, which is medial to your pelvic bone.
It's a good one.
Obliques. We can hit the iliopsoas, your QL, which is your quadratus lumborum. These are all muscles that could be. You could go to your PT, get them palpated, and let's see what we're rocking with.
Another thing we needle is scar tissue.
Ooh,
and this is
what a turn.
This is probably my favorite thing that we needle, actually. Mm-hmm. And I love all of the muscles you just listed. Like, they're all so beneficial. But scar tissue can pull so far from where the actual incision was that, like, you could have a tiny laparoscopic incision on the abdominal wall and you might be having lingering back pain from that years from now. So if we actually get in there with scar tissue, we're using a superficial needle, which has different perforations on it so that we insert it and we twist it and the tissue twists around the needle. And once it's twisted, if you try to pull that needle out, it will not budge because it has wrapped the tissue around it. Mm-hmm. And then we let it sit for a certain amount of time. And eventually we don't even have to untwist it. We just pull the needle right out. So you can feel the difference in tissue tension based on how it unraveled itself while it was in there. So we'll do that underneath an incision and we'll leave it there for like 5-10 minutes and we can retwist it. We can do it multiple times in different locations and it makes a huge difference years later even. That's the coolest part of scar tissue is if you didn't get it treated quickly or right away, we can still make such a big difference on it.
Even like 3 years later. It's never too late to start working on your scar, especially if you're having some kind of lingering abdominal or pelvic pain.
And we don't want to underestimate scars. That is a permanent trauma to the body that's going to linger there. And we want to make sure the tissue around it is moving well so that you can activate well and relax those muscles. And what's our biggest scar that we treat, Hannah? Cesarean. If you deliver with a C-section, oh my goodness, please see a pelvic floor PT who does dry needling for scar tissue. It is going to change your life and your recovery.
C-section scars are big O's. And wow, I'm using big O a lot today.
You're using big O a lot today.
I saw that word from Amanda. It's my favorite thing. She's good. C-section scars are the most common. We'll do fascial dry needling, which is what the superficial needling is. It's like gripping onto the fascia. And we'll do dry needling to the C-section scars. Another big one is laparoscopic scars on the abdomen, like Amanda mentioned. So we'll do that, especially after an endometriosis surgery, like an exploratory laparoscopic surgery. That's a big one that we'll do dry needling for. Even like if you've had like a like an inner thigh, like an upper adductor, like not adductor, like upper inner thigh. I've needled there before. That's been helpful.
Yeah, and we can needle scar tissue anywhere on the body too. If it's on the upper back, any like spinal incisions, like anywhere, it can be super beneficial.
I think we see the most benefit with abdominal scars, though,
Big time.
for sure. On top
I've been saying big time a lot. That's
big time.
big time.
But yeah, after needling the abdomen, we'll do like some scar tissue massage. You can also just do scar tissue massage if you're not up for the dry needling. I will say the fascial dry needling is more comfortable for me because it's more feels like pin pricky when you twist the needle up, but then once it sits there, it relaxes and you don't feel it versus trigger point dry needling is like a constant deep ache. So if you're interested in dry needling, sometimes I'll introduce people to dry needling by doing the fascial needling first if they do have scars we want to work on. And if they're anxious about the trigger point dry needling, we'll try that later on.
Dry needling comes in many shapes and sizes in and of itself, and we use it. It's a tool in our toolkit, right? So it's not for every patient, but when it is indicated, I think it is one of the best manual therapies that we can offer.
I want to give an example of why we love this technique so much. We recently got an amazing review from the Pelvic Institute, and it says, okay, I mean, not to amp myself up.
I was like, this is your review, isn't it? It's a really good review.
It's a good review, but the reason I'm mentioning it is because of the dry needling. This person said, Dr. Myers done more for me in 2 appointments than any other PT has done in 5 years. I was plagued with pelvic pain and it was controlling my life. 5 minutes of dry needling nearly erased 5 years of pain. So
that's pretty huge.
That's pretty big.
And that's a testament to the technique itself and your skill as a practitioner. So it's always going to be a combination. And just because you've had dry needling from someone doesn't mean that was the right provider for you also. So this review is a testament to you. So great job, Hannah.
Oh my God, thanks.
But like, how freaking cool is that? That 5 years of pain with dry needling gone.
Yeah.
And of course, you have to do rehab after.
We're gonna do other things for sure, but that just shows how well this person responded to dry needling techniques. So maybe with this case, we could continue to use dry needling more long term, not long term, but we could continue to use dry needling in future sessions in combinations with other treatment versus maybe if someone came back and was like, I didn't feel anything, with that patient, I might try other muscle groups, or maybe maybe they respond really well to literally just manual soft tissue work.
Yeah.
Or exercise. And that's mainly what we'll focus on. Everyone's different. But if you guys haven't tried dry needling and you feel like plagued with pain, like this patient said, maybe it's something that you could consider putting into your treatment plan. If your current PT doesn't do it, maybe see if someone else in the clinic does. And if not, then I would maybe try finding some other provider if you feel like it could be helpful to try.
Totally. All right, guys.
Let's wrap it up.
Let's wrap it up. Make sure you're following us on social media at Pelvic POV.
Yeah, guys, leave us a rating review if you like this. So
bye, Pelvic Freaks.
Don't leave us an abysmal review.
Oh, a double whammy.
Double threat.
Double threat.
Watch out.
All right. Bye, Pelvic Freaks.
Bye, Pelvic Freaks. Ooh, little kissy kiss at the
Love
end.
y'all.